Hi, I'm Millicent Miller. I work with organizations to help eliminate health disparities through strategic planning, partnerships, training, and capacity building. I recently had a chance to meet with some true change agents in New York's aging services field. We've documented what we've learned in this three-part series called Community Engagement in Area Agencies on Aging. This is part two of the series. Westchester County Department of Senior Programs and Services recognizes the importance of direct participation in cultural events, trusted institutions, and other opportunities for community engagement. The county's regional task force structure responds to the unique needs of the specific communities. Its telehealth and chronic disease self-management programs use peer-to-peer methods that help individuals see themselves in a shared experience with others also coping with chronic illness. In 2020, Westchester County stood at the epicenter of the COVID pandemic, reporting New York's first documented case of community spread. That experience taught Westchester County some vital lessons about the urgency of reaching all vulnerable populations equitably.
My name is Colette Phipps, and I'm with the Westchester County Department of Senior Programs and Services. I serve as the Director of Program Development, and I also provide oversight for our Livable Communities, a Vision for All Ages initiative. And we provide a vision for all ages. We recognize that we can't run a program that's a one-size-fits-all. We've divided Westchester into 6 regions, and the structure serves us well. We serve those regions in a way that gives people in each community what they need by responding to the interests that they have and the needs that they have. For example, in Mount Vernon is faced with a series of evictions. They need affordable housing, low-income housing, and those are different concerns from other parts of our county, where folks might be concerned about safety or sidewalks. We also have task force members for each one of our regions, and they bring forth the issues that citizens are concerned about in those particular locations. So it works well because we're meeting and we're addressing the needs, the special and unique needs of people in our communities. We believe that when you're engaging folks, you have to have them at the table. They should be part of the decision making. They need to be part of the process. So we say, tell us what's going to work. Tell us what's not going to work. A lot of programming decisions we know are concerned only with the outcome, but the process is so very important. The people you are developing a program for, they need to be able to say to you, this is going to work, but we don't think that this is going to work. So it's important that we make sure that we listen and we be guided by their voices. Our Livable Communities Caregiver Coaching Program was developed some years ago with the Fordham Ravison Center on Aging and the Department of Senior Programs and Services staff. We developed this program to better inform caregivers. So we have a cadre of volunteers that have been trained, fully trained, to work with caregivers. The most unique aspect of this program is all of the work is done by phone. This program has been replicated all over the country simply because you can talk to a caregiver in your pajamas if you wish. And the caregivers love it. They feel like they have their own personal person to work with. It, they, our caregiver coaches are sounding boards. They're empathetic listeners, and they help the caregivers to come to some of the decisions that they need to make. In terms of our care circles of Westchester, that's a guide, a step-by-step manual that we developed to help caregivers solicit the help that they need, and to help them also assist them to understand that sometimes they can't do it all. And so this guide is truly quite helpful in helping them to manage what they're doing by soliciting and asking others for help. Healthcare disparities are something that we are very concerned with, which is why I really believe that our chronic disease self-management program is so very important. The program is peer-to-peer. And I can say that we are able to recruit populations that we ordinarily would not have been able to recruit into some of these workshops. Why? Because it is peer-to-peer. So when a person sits in their workshop, they see someone who looks like them and someone who might have the same chronic illness that they have. And that makes all the difference in the world for someone who, may have not engaged or been involved at all before in these kinds of educational programs.
Hi, my name is Krish Drummond. So I am the nutrition coordinator for the Department of Senior Programs and Services. Our program provides the congregate and home delivered meals. So we serve about 5,000 seniors within Westchester County.
And can you share the biggest the biggest lesson learned in terms of engaging with this community?
So what I've learned is during the pandemic, there was such a need for food to be brought to our communities because all services had remained, closed. Our programs had stayed closed. So we had to bring the food to the community. Our senior centers and the site directors did a lot of work where they had to get out into the community.
What we do, we serve all populations, and here in Westchester County we had a diverse population, so white, African Americans, Latinos. In the Hispanic community we had barriers that we had to overcome in order to help the Hispanic population. The most important barrier is the linguistic barriers. A good way to overcome this barrier is that every day we had more and more bilingual social caseworkers, and that is a good way to overcome this barrier. The second barrier is the lack of knowledge and experience on the concepts or regulations, rules of the whole system, the housing system, the healthcare system. So what we do at the Department of Senior Programs and Services, we clarify these concepts, these procedures.
My name is Vivian Peralta, and I'm a social worker, social senior caseworker with the Department of Senior Programs, and I'm under the Case Management Unit. We provide case management services, the ISIP program. We also provide services in terms of the emergency service response, and anything else that a senior might need. They will call us for referrals and we will assist. When they call us and we provide that direct contact and provide them with that service that they are requesting, and we give them that information, they're like, oh great, Vivian, you know, you really helped me, thank you so much. That whenever they come up with another issue, they're calling us back. You helped me in, you know, getting that application through. Can you help me with this? And you know, you're there for them, for the community, and that's another way that we help them, and they're, you know, coming back to us.
COVID completely changed how we operate, and with the vaccine rollout, cultural hesitancies, we made sure that the public and the communities saw us face to face, that we were very hands-on, we were involved, and we decided to have presence. Recently, Westchester County started having cultural festivals. The cultural festivals take place on weekends, and they include different groups, different ethnic groups. We started with the Polish festival, we had an Albanian festival, Italian, Jewish, Muslim, Asian, and as a department, we decided to have visibility and presence at those festivals.
Well, I think one of the things that is the starting point, which a lot of the AAAs already utilize, is in terms of outreach, your library systems. The library systems to get the word out, of course, the community partners, the press releases, the flyers at the festivals that we have in Westchester County. But with the other pieces, it's important to know that you need to build these personal relationships.